second question is, why is patient-centered care important? Which I feel like we talked a lot about in our last question, um, but I think it's most important just so that patient feels like wanted and like you care about them. And
Yeah, I think that, like we said before, when the patient feels like they're important, then that helps them feel better mentally, and then also that can also translate to their injury. It makes them not only mentally feel better, but physically feel better also.
Yeah, I think it would help. It kind of even said in the article that a lot of places that did the patient-centered care, it helped speed up their recovery, and they had a lot more positive results with doctors and even other people, not just the doctors, like getting the whole health network team together. Like, so we would work with like eye doctors and physicians and stuff. And if we all did the same thing, that it helps the patient more than just like information pamphlets and stuff like that.
I definitely think part of the reason that helps too is because, I mean, to every illness and injury, like there's a psychological part about it too. And I feel like, we could be doing everything to help with an injury, or a doctor could be doing everything to help with an illness. And like not being able to get over that like mental like hurdle could keep somebody from healing or getting better. And I feel like when you like feel like you're being taken care of and feel like that, like healthcare providers putting everything into like your specific case, that kind of helps you get over that. Because
And I also feel like that when the physician is working directly with the patients, if they're more caring towards them, that the patient will be more willing to open up. Because if they're really closed off, they're not going to tell you like the most important, maybe sometimes some important details that could be going on at home that they don't think relates to it. But when you're friends with them, or really care about them, that they can really open up and tell you a little more information, which can give you a lot more background into what's going on. So that would help more.
yeah, I didn't even think about that. But yeah, when you have that trust, there's little things that people don't mention, but then they feel like they can mention when you like have that relationship with a person.
Yeah, and it could also it could give you some information that might lead to something else. Oh, you can try this. Oh, that's going on. You can do something else to prevent that or to help with that, and just they can get more information.
I think that's why it's important to get to know all of your patients too, is because everybody has such different personalities and they'll express themselves differently. So you might have to, somebody might just open up to you on the first day and be real friendly, but your other patients you might have to see a few times and have them revisit before they actually trust you enough to open up and let you know everything that's going on.
Yeah, going along with that, it just popped in my mind that it is important, but I think there should be some classes that go along with it because, like you said, the different personalities, and some of them are more overbearing than others, and sometimes they're just too open. And so you need some other training to know how to deal with certain individuals who are more closed off, how to bring them out. Mm-hmm. People who are sometimes we call annoying. You need to know how to handle those situations so it can be better use of your time and all that stuff.
Yeah, and definitely going off like the other point that you made, where we like use our like resources and talk to all like different types of healthcare providers is like you have to like I feel like one important thing is having a good relationship with your parent or with your patients, but then also having a good relationship with all those other healthcare providers and the ones around you, because you, instead of trying to take on everything by yourself, you have to be able to like ask for help sometimes. And even just if you do need to send somebody on, you want it to be with somebody like you trust and that you know will be good for that patient. So I feel like you can't act like you're the like best healthcare provider in the world and like you can fix everything, because even just like as athletic trainers, like there's some things that we just can't do or we just don't know about, or we don't know like the full extent of something, and you have to have a good relationship so that you can send them to that, which I feel like we have with like our doctors that come in. Mm-hmm. So,
and that's why you need everybody to be on like the same page too about the patient-centered care, so that when say we send one of our athletes to like Dr. Hartzell or to Joel, the chiropractor, because we do that a lot, to have them feel like the same welcome environment that we provide here, so that everybody, and you don't have any like.
And when the professionals get together to talk about their patients, that also feeds into making sure the patient is at the center of their attention,
Mm-hmm.
and so they know what's going on between them, so they can feed off each other. So it's all centered around the patient, and so each different health care profession can work on their own kind of patient-centered care, but all come together for the patient, not just themselves.